Hello. For my presentation, I'll be comparing the healthcare structures between the United States and India. The premise of this comparison will identify three core pieces of the healthcare system: cost, quality, and access. Let's begin by introducing the US healthcare system. While the US healthcare system appears to be very well organized and functioning, it really isn't. This is due to the primary fact that it doesn't contain a unified healthcare system. The United States delivers health services through a vast field of channels. Due to not being unified, the services jump from federal government level to state level, to private and public sectors, and on an individual level. On a basic level, the system may provide what it needs to, but the disarray of so many parts that should be working together keep the system from working efficiently. Health is important, but such goals aren't as prominent in the US healthcare setting. Now let's look at India's healthcare system. India's healthcare system is very decentralized. While there are private and public plans, the basic right to have free healthcare is given to these citizens. A universal system is in place that by the federal government, and facilities are ran on a state level. The primary limiting factor to this system, however, is being short of funds. Let's see how the government is involved in these healthcare settings. In India, the responsibility of health, as we stated before, is split between central and state governments. This setup is simple. Federal government is the entity in charge of employing health policies, while the state is the entity that ensures the proper delivery of healthcare services. India's federal government has the Ministry of Health and Family Welfare that is split into two departments, that being research, which aids in training and research, and health and family welfare, which is responsible for organizing health programs. So let's talk about what that means. What does it show? It shows that there are dedicated bodies used to manage and deliver healthcare services. This is a part of a unified system that aids in creating certain goals that which these entities can efficiently focus on. This extends into rural villages as well, where small government bodies establish primary health centers at a district level. So how is the government involved in the United States? The US government serves as both a regulator and a payer within the healthcare industry. As a regulator, the federal government has a big influence on larger providers. The government, having spent more money than any other company on a health insurance, proves that the government serves more as a customer that inadvertently influences the flow of costs and resources of healthcare services. Having a dominant payer would have been thought to be beneficial, but it also creates chaos. As of now, there are a lot of factors that determine what is and isn't quality healthcare, which creates inconsistency between facilities. The idea of having a big overlying entity would have been thought to create a more singular, regular standard quality to uphold. However, it favors the process over the quality of healthcare. As the largest payer, providers and other healthcare businesses must listen to the demands of their highest buyer. Let's identify some positive effort. The federal government has brought to light the importance of preventative treatment in relation to cost effectiveness. This was through the Affordable Care Act. The ACA focused on the inconsistencies of proper preventative care concerning diseases, all while putting in effort to lower costs and promote health. Centers for Medicare and Medicaid Services, CMS, a federal agency or one of the many, they hold the proper power to improve quality of healthcare in the United States. They have the reach to affect even the private sector, the state government, and other healthcare stakeholders, but they haven't done much. The federal government has put in effort through legislature to improve the quality of preventative treatment, but its role as a consumer and a buyer of the healthcare market really muddles the quality and the cost of healthcare insurance and other plans. Let's move on to the financial aspects of healthcare. In these two countries, what role does finance play when it comes to healthcare delivery? While India is universal, there are consequences. And due to the US not being so consistent in its delivery, a proper way to understand how it's delivered is through the financing of it all. Health insurance providers are a financing link between consumer and healthcare provider. In the US, consumers join an insurance plan, paying for the plan in which they've enrolled in. Consumers pay a little while the insurance companies assume the risk of any payments that the patient may incur. There are private companies and public companies. Most people in the US are privately insured through being employees, and publicly through Medicaid, CHIP, Medicare, which are all financed through the federal and state governments. Anyone who is uninsured will have to pay out of pocket or avoid getting any medical care at all. The primary reason for being uninsured is because paying for healthcare can be expensive. In the view of there being different employers in the private setting, as well as those who may not be eligible for public or refuse to partake in medical care at all, the US system doesn't incorporate everyone as well as it should financially. How healthcare is accessible will be discussed further along. In India, healthcare is free in many public facilities. This means no deductibles or cost sharing, etc. But there's a catch. Funds for the healthcare system are low, very low. So, any primary funds they obtain are from outpatient costs. So, to summarize, everything is covered except the outpatient due to the lack of funds India has to support its system. About 30% of the population is privately insured, but such insurance is expensive. To counteract this, the government has employed safety nets for its citizens, such as the National Health Protection Scheme, in which the federal and state governments share the cost of health services. But due to high outpatient costs, it's been pushing citizens to impoverishment. Let's move on to identify the quality in healthcare. In India, the quality is controlled by the central and state governments through a mix of policies and standards. Accreditation and education are very important to the healthcare system in India. The board used to accredit facilities uses various international standards in order to allow facilities to be fully established in India. It is difficult to measure quality, however, since it is only based on word of mouth and number of resources a facility has, which varies from facility to facility. What truly boosts the quality in India are the recognition of facilities. Certifications, awards, praise, these all boost the reputation and the financial resources of an establishment. When recognized, such facilities can grow through training and higher performance. Quality tends to improve the more as one goes up in the hierarchy of facilities, starting at the public level with clinics, which then move up to hospitals and then to outpatient care, where costs start increasing, compared to then to the private level, where quality and costs are higher. Similar to the US, however, there is no simple standard of quality enforced that healthcare is brought up against. Looking at the quality in the United States, as said, there's inconsistency just like India. Resources are often wasted in providing insufficient healthcare through time and poor quality. Technologically, the US has advancements, but due to there not being a unified system, the way technology is used is more so inadequate at lower levels. Quality also cannot be accurately measured in terms of what results from different types of care. Where there are no set standards, the patients or customers must wait long periods of time in order to retrieve the care that they require. Not only that, but must have to pay for it one way or another after. Paying for questionable quality leaves area for improvement. Lastly, we can address the ease of access. The US and India share and differ a lot in terms of healthcare access. The primary difference is the way the facilities are structured to ensure a universal access, a physical presence. Both countries have healthcare disparities, with wealth distribution being one of the leading factors shared between the two. Socially disadvantaged groups don't have such easy access to healthcare as the opposition. For example, in India, there are variances in the proper recommendation for prenatal visits concerning pregnant women. When surveyed, 77% of the prenatal women had received care, but 55% of them only went the recommended 3 or more visits. Speaking of wealth, in India, the poor are more likely to utilize public services rather than the private. However, the rich take over the public sector due to them needing more services and staying under care longer than normal. Those that can afford the private sector take advantage of the public sector and in turn leave no spots for the poor. As established before, India has many clinics available from within rural villages to the heavily populated areas. Locationally, access is phenomenal, but the US doesn't share a similar approach. Gender, income, and ethnic inequalities are very prominent in the United States. Socially disadvantaged demographics, the poor, minorities, face difficulties in getting proper access to healthcare because of these biases. Being a market, the system in the US favors the rich, or consumers that it can get the most money from. While there may be centers available in the disadvantaged demographics, there is a cut in quality for the price of ease of access. My final thoughts on the comparison are such: costs, quality, and access are all interconnected, in where imbalance in one may affect the other. Poor quality might mean more access and less cost. Higher costs may mean higher quality and less access. Inconsistencies in both countries create a struggle for adequate healthcare. The United States has poor access and poor cost in relation to the undetermined quality, while India holds adequate access to healthcare, but the cost and quality may sometimes be questionable. These are some things that both need to find a balance in.